As New Hampshire keeps seeing record numbers in the pandemic, many of you have questions about COVID-19.
So we ask you to send in your questions for Governor Chris Sununu. He joins us live now to answer those questions. Let's get right to them. Good evening, Governor. Thank you so much for being here with us.
Absolutely.
Well, we have a lot of questions to get to, so let's get started.
Sure.
Josh asks, when will the state adopt the CDC guideline for 5 days of isolation when positive with no symptoms? Governor, that actually just happened this afternoon, right?
It did. The CDC came out with the final guidelines just this afternoon, and the state will be adopting them. So we spoke to the schools today. Dr. Chan was on a phone call with the schools, and at our press conference tomorrow, we'll go through some of the details, but it's effectively a 5-day quarantine and isolation guidance as long as you wear a mask for another 5 days. That's their guidance, and that's what we'll adopt.
Paul is asking, where can we get home tests as soon as possible?
Online, nh.gov/COVID-19. We still have home tests available. Very proud of the fact that New Hampshire has led the country in terms of availability of home tests. Our Say Yes to the Test program was the first one to go statewide. We've done it twice now, and I believe there are still some available if you go online. Also, there will be another federal program that has been announced. President Biden did announce that. Not sure when that will be, but I think as for right now, our state program is working very, very well. So go online and check it out.
A Twitter follower had another test question asking, why are the free government COVID tests limited to 1 per household? Our household includes 5 adults and 1 teen, most of whom are out at work or in school.
So it's 1 order per household. I think the first time we did it, you could get up to 8 tests. The second time, I believe you get 4 tests. So it is 1 order per household, but there are actually multiple tests within there.
Timothy asks, why aren't you letting your state employees who are able to work from home? New Hampshire was recently the state with the highest number of COVID-19 cases per capita in the entire country. Don't you think that would ease some of the thousands of employees' minds who have done nothing but sacrifice and work hard over the last 22 months?
So first and foremost, the state employees have been incredible over the last 2 months. They really have. 22 months. They have done everything from our call centers. They've adapted. We had remote work for a while, and then months and months ago, as everything kind of came back into normal, we got rid of our state of emergency. All the provisions that allowed for remote work, at least at the state level, went away. They went away with the state of emergency. So everyone is back in person. There are some jobs that were traditionally held remote prior to the pandemic, and you can still do those remote. But right now we are back at work. This is a long-term game. One of the things I talk about all the time is if you're going to put in mandates, if you're going to put in restrictions, or you're going to put in new provisions, you better be prepared to have them for the long term, potentially years. I hope COVID isn't here for years, but it could be. So one thing we try to do is get back to normal as best we can, and with all the different precautions we can take with vaccines, with boosters, they work very well. Social distancing, all these other provisions we can use in the workplace. There's no reason we can't be back in the workplace in a very safe manner.
Joseph asks, numbers are rising, deaths are rising, hospitalizations are still up, and our healthcare workers are being stressed to the max. What are your limits as far as how bad things have to be before you impose more widespread mitigation strategies? Vaccinations alone don't seem to be cutting it.
So we go back to March of 2020, right back to the beginning of this, where we always talked about making sure that the healthcare system didn't get overwhelmed. And there's no doubt it is really at capacity and has been for quite some time, especially with the workforce shortages we're seeing in healthcare. So what we've done is put together all these different mitigation efforts in terms of allowing folks to move from an emergency room to a long-term care facility, prepaying effectively those Medicaid payments to get folks out of the hospitals and take the burden off the healthcare system. In just 3 weeks in December, we licensed over 650 nurses. We streamlined that process to put more staffing on the floors and open more beds up. Now we have all these strike teams coming in. We have a Health and Human Services medical team coming in. We have our FEMA teams coming in to help reduce some of the burden on the emergency rooms. We're making sure you can get testing and getting your vaccines away from an emergency room and away from the hospital. So we put all these pieces in place to provide that flexibility for the healthcare system. Now, when you do a statewide mandate, that requires a state of emergency, and it's also not taking into account where we are in different parts of the states, what's happening locally with transmission, locally with hospitalization. So again, we could be dealing with this for a long time. So if you start with mandates now, just a big unknown where it's going to end. And the other issue is, if you start with mandates, and some people want to treat them like a light switch, well, just do a mandate for a month and then you shut it off. And then you do another mandate in the summer and then you shut it off. It creates a lot of uncertainty for folks and a lot of uncertainty in communities. So planning for the long term, a sustainable long-term measures is really what is the best path forward for the state.
Governor Sununu, thank you so much for answering
bet.
those questions. We have a lot more for you. We'll get to those after the break.